Though pelvic floor muscle dysfunction appears to be a primary driver of chronic vulvar pain, it is possible that the muscular dysfunction is secondary to abnormal tension in the surrounding abdominal and pelvic viscera, fascia, and muscle. Together, these abnormal physical findings make internal assessment, whether digital or with the speculum, painful, difficult at best, or oftentimes impossible. This video will introduce 5 simple patient activities that can be used prior to intravaginal examination. Those activities include deep lateral diaphragmatic breathing, self-stretching of the lower abdominal wall, bilateral stretching of the deep hip muscles, active bridging, and active pelvic floor muscle mobilization. 3 women with chronic vulvar pain, Kathy, Holly, and Lisa, were assessed prior to and following instruction and completion of these activities. 0 to 10. If 0 is no pain, 10 is the worst pain ever. What does this feel like? Give me a number.
Like a 6 or 7.
6 or 7. And this is right at the bottom. This is right at the posterior fourchette. I'm going to turn my finger to the left, 3 o'clock, and give me a number there.
10.
10. And over here on the right?
9, 10.
9, 10. So not very good today. Using gentle digital palpation prior to those activities, each woman's vulvar pain was assessed at 3, 6, and 9 o'clock at the introitus. My assessing digit remained at the posterior fourchette throughout the completion of the activities, allowing me to reassess changes as they occurred. Now, I want you to put your hands on either side of your rib cage for me, low down, and I want you to put a little bit of pressure. And I want you to take a really deep breath for me. As you do that, I want you to push your rib cage out. Wonderful. I don't want your belly to go up. I don't want your chest to go up. When you get to the end, go ahead and breathe out. I want you to do this 5 or 6 times for me. And as you do that, your diaphragm goes down to pull the air in. And physiologically, as that happens, that's a transverse pressure down from the respiratory diaphragm all the way down to where my finger is. My finger's still where it was. I'm going to move it just a little bit. I'm still at that 6 o'clock spot. How does it feel now?
A lot better.
Can you give me a number?
7.
How about here on the left side?
8.
8. How about here on the right side?
7.
Yeah. Now I want you to take your hands below your belly button, and I'm going to have you scoop in and pull up for me. And I want you to hold it there. There's a ligament on the back side of the abdominal wall that goes down behind the pubic bone and into the pelvis. And relax and let go. Now I want you to do that again, and lift and pull. Clinically, what seems to happen is that bit of fascial pull releases tension all the way down through the bladder, through the urethra, and into the pelvic floor muscles. And relax. Let's go back to 6 o'clock. How does it feel there now? Give me a number.
There's barely any pain.
Barely any pain. How about here on the left?
2.
And here on the right?
3.
Okay. So now I'm going to have you stretch your hip muscles. I want you to bring this right knee and take it up to your left shoulder. Grab hold of it and give it a good stretch. There are 5 deep rotators that lie right adjacent to the pelvic floor muscles. I found clinically that a stretch of these muscles really help to relax pelvic floor muscle tension. So bring this knee up to the opposite shoulder and back down again. I'm at 6 o'clock again. Give me a number.
3.
3. How about here on the left?
4.
And here on the right?
3 or 4.
3 or 4.
Yeah.
Okay. Now I'm going to keep my finger here back at 6 o'clock again. And I want you to lift your hips up towards the ceiling. Go all the way up, and I want you to hold it for 10 counts. This is an extensor activity, trunk extension, hip extension. All of those muscles tighten to hold. Oftentimes the adductors will squeeze. Pelvic floor is such a follower. It goes along and it holds tight too. After 10 seconds, you come down and relax all of those muscles. And now give me a number at 6.
2.
And at 3. 1. And at 9. 2. Good deal. Now we're going to do pelvic mobilization. I just want you to pull your pelvic floor muscles in like you're holding back gas and pee. Squeeze and hold for 5. 1, 2, 3, 4, 5, and let go all the way down. And then 5 quick ones. 2, 3, 4, 5, and let go. Now I'm back at 6 o'clock. How does it feel?
No pain.
Wonderful. How about here on the left side?
None.
And over here on the right side?
None.
Fantastic. And now give me a number at 6.
2.
And at 3. 1. And at 9. 2. At 6 o'clock, how does it feel here now?
2.
A 2. How about over here?
2.
And over here?
2, 3.
You feel like you have any more space down there?
Yeah, it feels looser.
Feels looser and more
Yeah.
relaxed, less burning.
Yeah.
Wonderful. When assessing women with chronic vulvar pain, please consider using these strategies to decrease tissue tension, reduce anxiety, and lessen palpated vulvar pain prior to performing intervaginal examinations. Our internal assessment should not cause more pain. Rather, we should start by giving women hope that they are not crazy, that this pain is not all in their heads, and that there may possibly be some very simple things that they can do to begin to help themselves regain control of their bodies. Thank you for your attention.